Looks like most of us are here, so to be respectful of you all's time, we're going to go ahead and get started. Hello and welcome to our pre-arrival webinar this morning. My name is Karina Ivanyan. I use she, her pronouns, and I'm an intake advisor here at the International Services and Engagement Office, otherwise known as ISEO, here at UC San Diego. And today we'll be talking about student health, specifically the incoming health and insurance requirements for all of our newly admitted students. On behalf of the office and our team, I would like to congratulate you on your acceptance to UC San Diego. We're really excited for you to join the Trident community and for you to begin your journey to the United States. And we're here to provide you with, social experiences as well as the support when it comes to your visa processing. Can't wait to, meet you all in person in the fall. But for now, we're glad that we're able to connect with you virtually through these webinars. Since I already had a chance to introduce myself, I'm joined by amazing colleagues across campus, as well as some of our partners from outside of campus. And so I'm going to pass it over to Jill to do some introductions as well.
Good morning and welcome to UCSD. My name is Jill Batika and I am the Billing, Insurance, and Medical Records Manager at our Student Health Clinic here on campus at UC San Diego. And I'm going to pass it over to my colleague, Annie Horton.
Thank you so much, Jill. My name's Annie Horton. I am the Director of Nursing from Student Health Services and can assist with all the incoming health requirements. And then Bella.
Hi, hello. Hi, I'm Bella. I'm representing Student Medicover. I am a proud UCSD alumni from class 2020.
Thank you all. To give you a quick overview of our agenda for today, we're going to review some first steps checklist reminders. So those are important steps that you'll need to complete before starting with other processes here on campus. Then we're going to do an overview of student health services, incoming health requirements, insurance, and then upcoming webinars and Q&A at the very end. Before we begin, a few housekeeping things. You are in listen-only mode, which means you can hear us, but unfortunately, we cannot hear you. We want to make sure that we answer all of your questions today, so this is why that Q&A feature on your screens is super important. Please don't hesitate to ask us questions throughout the webinar or at the end. In case we don't get to everything, if you're looking to connect with ISEO, you can always contact us by going to icontact.ucsd.edu. And lastly, we are recording. We're going to cover a lot of great information today. So if you would like to review the content of today's presentation, please don't hesitate to go to inewstudentwebinars.ucsd.edu to watch this one or any of the previous webinars that we've done. And this is just one more kind of, look at that Q&A feature on your screen. So look at the control panel and feel free to type your questions there. And once again, welcome. We know you worked so hard, to submit all of these applications, and we're really excited to celebrate with you your acceptance to UC San Diego. To help you prepare, on next steps, we wanted to cover some of the checklist items that you'll need to complete. First and foremost, you'll need to log into applicant portal to complete the enrollment checklist. So this is outlined for you by the admissions office. In there, you'll need to accept your offer of admission. And then, if required, complete the California Residency for Tuition Purposes questionnaire. Once that is done, in about 2 to 3 days, you'll receive an email asking you to create your Trident Link Active Directory and Duo accounts. So this is how all of our students, access the UC San Diego systems as part of this Active Directory. You'll get a UC San Diego PID, which is your personal ID number, as well as email. And you'll be able to, set up your password and start accessing the different systems, some of which we'll go over today. Then, you can begin your process of starting to request your immigration documents. So an important resource for all incoming students is our inewstudent.ucsd.edu website. This is where we break down the process of requesting the immigration documents, how to apply for your F1 or J1 visa, and also important pre-arrival pieces. So I recommend you bookmark this page and then read through it for the specifics of, how to go through these processes. This is just, again, the breakdown of setting up your PID and Active Directory accounts. So you would want to come up with a password that will allow you, to access the resource, such as registering for classes, financial tools, iServices, which is the system where you'll be requesting your documents. And then, also just once again, that piece about the statement of legal residence. So that is something that you'll complete in the applicant portal as well. And then do know that this can take a while. So unfortunately, it's not automatic. So we recommend waiting about 48 to 72 hours. That's usually how long it takes before you're able to see and access any of the systems. That is all I have, so I'm gonna pass it over to Annie for some incoming health requirements.
Thank you so much, Karina. And yes, I'm going to be going through all of the requirements that the University of California has to keep us all safe in terms of our health needs. So why we do this really is because we're really wanting to prevent as many vaccine preventable disease outbreaks as possible. Every year, we have various outbreaks all over the world. When they occur in university settings, they really do cause a lot of disruption to academic life. So where we can prevent illnesses, we definitely will. And that's really what this policy is based in. And the health requirements that UCSD has, there are two main categories. The first one is tuberculosis. And for some people, that will be a questionnaire and that will be it. And for some folk, especially folk such as yourselves coming from outside of the US, it will also include tuberculosis testing. And the screening questionnaire will tell you at the end of it whether you will need testing or not. And then we have what we call our core 4 vaccines, and these are Tdap, which is tetanus, diphtheria, and pertussis, MMR, measles, mumps, and rubella, varicella, which is chickenpox, and the meningococcal vaccine. And the deadline for all of those, for TB and our regular vaccines, is July 14th. And then we also have the COVID-19 vaccine and the influenza vaccine that you can get once you're on campus during the fall or winter. They are seasonal vaccines. Everything that I'm talking about today can be found on our student health website, which is under health requirements. And so all of the forms are there and all of the instructions and helpful links can be found there. So please feel free to go back to this. If you've got questions, you should be able to find a lot of your answers there. The new forms will be up before May 1st, which is when all new students are entered into our system, our health centre system. Starting the process, as Karina mentioned, relies on you having your UCSD AD login, which is your UCSD email and the password that you choose. And this whole process occurs in our system, our student health portal, which is our electronic medical record where all your information, health information, is securely housed. So there is a student portion facing you, which is called My Student Chart. You can access that through a desktop or an or the app, and you can, once you go in there and activate it, it is available for you, and this will be the way that you will submit all of your information, as well as the way you communicate with us and we communicate with you. So it's really important that you go in and activate that My Student Chart as soon as you're able to do that. So the admission enrollment checklist, or the Triton checklist, you will find all of this information on there too as an undergraduate, and there are links to My Student Chart, there are links to our webpage and all of the forms, and it will give you basic information as well as the deadlines. And you can see there the immunization and the tuberculosis information. And then the third one is further down in the Triton checklist, because COVID-19 and influenza vaccines are given during the fall or the winter quarters. So you will find that further on in that list. My Student Chart, as I mentioned, is the student-facing portion of our electronic medical record, and you'll see various ways of logging in there, but it's very important to know that you can, to get to the student health portion of it, you log in using your UCSD student AD login. Don't come in any of those other ways. Those other ways are for UC San Diego health patients, not students. And if you go in that way, you won't see all of the items that are needed for the incoming process. So if you're looking at and you can't find anything, this might be why. And if you can't get to this page in here currently, it's because you probably haven't been loaded in yet. So those loads, as I mentioned, for students, incoming students, start around May 1st. And so once you are loaded into our system, then you will be able to log in here with your AD login. And once you go into My Student Chart, you can navigate around it most easily by using the menu. There are other buttons, but I'm just going to focus on the menu. And if you scroll down the menu, all of the incoming requirements, or the main two, TB and immunizations, are found on the immunization and screening page. COVID-19 is its own section, and you will see that. Yeah, this is the main way that you will get into here. As well as, you'll see at the top messages, and that would be the way that you can reach out to the nursing team whenever you have a question, and it will also be the way that we communicate with you. So it's important to note that as well. Once you get into that immunization and screening portion on the checklist, you will see two big yellow buttons with start buttons in them. And the first one is the TB, and the second one is the immunization history screening. And so this will lead you into, for the TB, into the questionnaire. And for the immunization, it will lead you into a form where you're able to put dates in and upload your immunization records. Immunization requirements, you'll be obtaining those records for all of the vaccines that I mentioned, and the form is available on our website. And the form will guide you and or your healthcare provider as to what each requirement entails. So for example, Tdap is 1 dose on or after the 11th birthday and every 10 years. Measles, mumps and rubella is 2 doses, with the first being on or after your first birthday, with at least 28 days in between doses. And varicella is the same, and then meningococcal is 1 dose on or after your 16th birthday. If you're not sure of your MMR and varicella history, or if you've had varicella, which is chickenpox, you can get a blood test to show immunity, and there are spaces to enter the blood test date in there. Some of you it may be wise to go to your healthcare professionals, especially if you have gaps in vaccination, or if you're not certain of your vaccine history, they'll be able to help you. But if you have a really good immunization record from your school or anywhere else, you may be able to do this process yourself. But once you enter that information, it comes to the nursing team, and if there are any errors or gaps or a requirement not missing, we will reach out to you and let you know how to actually achieve each individual vaccine requirement. And as again, the deadline is July 14th, and we really encourage you to get these dates in as soon as you can. The downside is if you miss the deadlines is that an enrollment hold is placed, preventing enrollment in classes. So it's really important to get onto this process as soon as you can. When you're entering the dates into My Student Chart, if you hover over the little information, the little eye bubbles above each of the vaccines, it will give you the information that you need about each requirement. And just a note, there are more boxes than are needed there, just in case you've needed to get additional doses for some reason. So there is space to enter more information. With a vaccine like measles, mumps, and rubella, there is also the option to put the dates if you've received individual and not a combined vaccine. So there's lots of good information in the form as well. And if you've had the vaccine before and it's already in our system for some reason, then it'll show it already as completed, so you won't be required to enter it in again. And as mentioned, COVID influenza vaccines, you can enter your most recent date if you wish when you do the submission, but this requirement, we give you plenty of time to obtain these vaccines in the fall or the winter. It's just a single dose of each of these vaccines now. They are treated identically. The CDC, we release a new vaccine every fall, and it's just the requirement. We're not so concerned about previous vaccines. Really, the most important thing is that you've had the most updated vaccine dose. So most likely when you're entering in your fall dates, you won't have had that yet. And that is totally fine. These vaccines, actually all vaccines are available at Student Health if you do have any gaps. If you have our UCSHIP insurance, which Jill will be talking more about, all these vaccines will incur no charge at all. So you can easily, through My Student Chart, book some time in the fall, and we get hundreds and hundreds of students coming in during the fall to get vaccines. Perhaps you haven't been able to get in the countries that you're coming from, or that you may have had a gap you didn't realize. These vaccines are all also available in all retail pharmacies in the US, as well as doctor's offices and the usual places where you might obtain vaccines. And it's very safe to get both these vaccines at the same time, and many students do that. So just to let you know that. The tuberculosis requirement. For this requirement, we're really wanting to prevent people from coming to school with tuberculosis. Obviously, it's a highly contagious disease. And so we're really wanting to screen and test as many people prior to them coming to campus. And it's a series of questions that you will answer. And then if you're prompted, you will be requested to get a test. You will need to take our testing form with you to your healthcare provider, and we accept most forms of testing. Some that you may be familiar with is the TB skin test, or PPD. The other one is the blood test, which, depending on where you go, is called quantiferon or T-spot testing. That is really the gold standard for testing. So if you can access the quantiferon or T-spot test, that is the test that we would really prefer, but we will accept the others. If you received a TB vaccine as a child, then quantiferon testing really is the most accurate test. We also will accept chest X-ray. This tells us only whether you are clear presently of tuberculosis. So if you submit chest X-ray for tuberculosis screening, we will reach out to you during the fall and winter quarters to get some additional testing in the US. Because some people have a form of TB that is latent or inactive, but it needs to be treated. So we really want to support you to get that detected early if possible. So all of these, the form plus any blood tests and chest X-ray reports will be uploaded in my student chart, and a registered nurse on my team will be reviewing these results, and then we will be messaging you if there is any issue or any additional testing that is needed. So it's very important again to get onto this as soon as possible. Now, holds for tuberculosis are placed around the July 14th mark. So it's very important to get onto this process because for some people it can take a little more time than just the initial testing. So in terms of obtaining help, as I said, Ask a Nurse, which is a form of messaging in my student chart, comes to a team of nurses and medical assistants, and we are monitoring that during US business hours, but also after hours as well, and in the weekends, but not quite 24/7, but you can expect a response from us quite quickly. Around the deadline and hold dates, we do get inundated with messaging. So get in and ask your questions early before those deadline dates. Don't leave it to the last minute, so that you can get a quick response and we can guide you as much as we possibly can. If you are having technical issues of any description, I do have an email address up on the screen that you can use that comes through to medical records, and they work with myself and our IT friends to help resolve any issues that may be happening. Sometimes it's we need to involve the campus partners to help us with that. But yeah, we're there to support you. And as mentioned before, all of the information and forms, etc., can be found on our website. And but yes, please reach out to us early. We understand that there can be delays in healthcare in various countries around admission times or around immigration testing. And so, yeah, please let us know if you're having any issues, and those queries will be routed through to myself, and I can have a conversation with you around that. So yeah, please let us know how we can help, and we're really excited that you're coming to UCSD. So thank you so much.
Thank you, Annie. Again, my name is Jill Batika, and I'm the UCSD Insurance Billing and Medical Records Manager here at Student Health on campus at the University of California at San Diego. And I'm here to tell you about the health insurance requirements as part of your enrollment at UC San Diego. So this is a picture of our student health campus, or our student health clinic on campus currently. You'll find us right across from our Price Center eateries where people can go find lunch or a meal. We're right across from the Target that is located on campus or the school bookstore. There are many initiatives that happen on our campus that we take part in, and one of these is the Principles of Community. And I just wanted to ask that you join me in upholding the University of California, San Diego Principles of Community and keeping our community free of any and all forms of discrimination and harassment. If you'd like to learn more about this initiative, please visit the URL on the bottom of this slide. I've provided you with some of the most frequently visited pages on our student health website. The quick reference codes here will take you to find out more about the University of California Student Health Insurance Plan, our student health clinic here on campus, the waiver process for health insurance, and the RAFT offering that we're going to talk about today. So you're going to hear the term SHIP a lot, and it's SHIP standing for Student Health Insurance Plan. The University of California has this particular plan across the state of California for all the UC systems. While many schools are adopting their own insurance plans, UC has been implementing this for a long time to ensure the protection of students and the campus community. What makes UCSHIP unique is that it's specifically designed for UC students with their input in shaping the plan. UCSHIP offers high quality, affordable, and convenient coverage that helps protect students from unexpected healthcare expenses. If you're near another University of California campus, you can access their student health services clinic just like you would at the San Diego clinic. Additionally, the UC SHIP plan provides worldwide coverage. So if you're planning to study abroad, I encourage you to take advantage of this benefit. The premium for the 25-26 school year for undergraduates will be $987 per quarter. If you break that down, it would be annualized at $2,961 for an entire school year. We charge it 3 quarters. And if you break it down further to a monthly amount, it's $246.75 per month. And again, that's in US dollars. I strongly encourage you to talk to your support system at home to make the right choice for you and your medical needs. Again, this is a picture of our student health clinic in that corner, and the quick reference code there is provided so you can find out about the services and the providers that we have at our student health clinic. All registered University of California students are welcome to visit the student health clinic for primary care and urgent care needs while you're right here on campus. The clinic is open year-round, Monday through Friday, and during the summer. For students participating in the UC SHIP program and maintaining the school's health insurance that's offered, student health is your primary care provider home. So that means if you're sick or you're ill and it's not an emergency or an urgent situation, you would make an appointment with us and see one of our providers. We have lots of availability because we're only open to students. We're not open to staff or to the public. You can schedule appointments by contacting our phone number on the screen or by visiting My Student Chart when it's available to you. The clinic provides good access to providers and is exclusively for students. To schedule appointments, again, go to the website, My Student Chart. Note that the appointment line provides after-hours medical advice. When you're not making an appointment, a registered nurse will answer the phone line and help you determine if your level of care is urgent or emergent, or if you can wait until the next day to set up an appointment and see one of our providers. If you do opt out of the student health insurance, and we'll talk about that, and you have your own insurance, you can still come to the student health clinic and we'll work with you on getting reimbursement claims in place so that you can seek reimbursement from your home insurance company. But do please keep in mind that for an office visit to see a provider in the United States and at our student health clinic, it runs about $89 to $159 each time you see someone. I'm going to talk about the RAFT offering that will help you with that if you are opting out of the insurance requirement. So if you do come to our student health clinic and you're seen by one of our providers, these are the payers that are accepted at our clinic. For the SHIP students, if you're enrolled in the student health insurance plan, your services will be billed directly to the student health insurance plan health plan. The only out-of-pocket expenses would be for prescription copays or over-the-counter items like cough drops or toothpaste, things like that that we would sell that you don't need a prescription for. These services can be paid by credit card at the time of service, or we will transfer them to your bursar student account where you can pay them at the same time as you're paying tuition or any other registration fees. For the RAFT students, this stands for the Reduced Access Fee for Tritons. This means that you have successfully waived the UC SHIP plan and you have your own insurance. The last question on the waiver application is, would you like to pick up a raft? And the raft offering is $70 per quarter. You pay that and you have unlimited visits at our student health clinic. You don't have to pay for any lab services or x-rays when you come see us. If there is something that you pay for, again, we'll help you get the statements in place so that you can seek reimbursement from your insurance. A fee-for-service student is a student that waives the student health insurance requirement and has their own insurance and didn't opt for a raft. If you waived the SHIP and did not choose a RAF, you will be considered a fee-for-service patient, as we don't hold agreements or contracts with any external insurance companies or the California State and Medi-Cal government offering. You will be responsible for all services rendered at the student health clinic. For students with RAFT or those classified as fee-for-service, again, we can provide an itemized receipt that you can use to seek reimbursement from your insurance company. This is a picture of our cost of service grid, and that's found at the URL provided on the page. Again, it runs on this page, it does say 44 to 159 is what it would cost for an office visit or a nurse visit in our clinic. And then you see the supplemental charges for any other services that are obtained here. If you have mental health or behavioral health needs, we have our counseling and psychological services on campus, where we house over 30 psychologists, and we have many social workers that will work with you to get the help that you need, or a referral off campus to see a psychiatrist or another psychologist. If you are covered by the student health insurance plan, we will write you a referral, and it's a $5 copay to go see a specialist outside of our campus. If you are a fee-for-service patient, we're going to ask you to contact your insurance so you can find out what the right resources for mental or behavioral health are for you. Students can schedule with our counseling and psychological services throughout the campus by going on to the My Student chart, and you can find out more about the CAPS offerings, because there are many, and there are online resources as well, by clicking on the QR code or by going to the website with the URL provided. So let's talk about some of the benefits of this health plan that we're offering to our enrolled students. The first thing that you want to keep in mind is that we are trying to be ecologically minded and not send out any kind of paper goods. So we ask that you upload your insurance card through an app called Sydney on your telephone or your mobile device that you might be using. You won't be able to do this until the first week of school in the fall, so don't try it now. You can take a look at the app, but you won't be able to load your information and get your card successfully, because we don't know if you're going to keep the SHIP yet. But what you want to do if you are keeping the student health insurance plan offered through the school is to upload this app. It will provide you a copy of the front and back of your insurance card with phone numbers to the insurance plan that you can contact for any kind of assistance. It also shows you the claims processed under your name, so you can see if anything is denied or how it was paid or what your out-of-pocket expense might be for a particular service. Under this health insurance plan, it is called a PPO, and that's a participating provider organization. It means that you have more versatility than other plans to go see the provider that you want to go see or the facility that you would like to go see. Under the plan, you have 3 tiers of medical coverage, and every student gets this. It's not one or grads or versus undergraduates. All students get the same benefits, and you get to choose the tier of benefits that you want to utilize. So if you come to the student health clinic and you see one of our providers, and the provider recommends that you go see a specialist of any sort, like an allergist or a dermatologist or a surgeon, you can pick from the UC tier, the Anthem network, or out of network. The UC tier of benefits is going to maximize your benefits and leave you with the least amount of out-of-pocket expenses. We have 3 acute hospitals in our neighborhood that you can access, where they house over 300 specialists. If you receive a referral from one of our providers, they're generally going to refer you to the UCSD health system, and you can schedule those appointments right through My Student chart. When you see a specialist, it's a $10 copay. If you do have a service like an MRI or a CT scan, you can go over to the hospital and have that done, and that's covered at 90%. You pay a 10% co-insurance. If you are receiving a referral from one of our providers and you decide that you don't want to go to the UC providers, you want to access the Anthem Blue Cross network of providers, and that's the insurance plan that underwrites you, you can contact Anthem at the phone number on your insurance card or go to their website at anthem.com and seek out providers. If you do see a provider that's not UC affiliated, it's a $30 copay to go see them each time you go. And if you have a diagnostic service or a hospital-based service, those services require a $500 deductible be paid by the patient first, and then your services are covered at 80%. Again, leaving the patient with a 20% coinsurance plus that $500. If you decide to go out of network, which we highly discourage, it means that you're going to pay a $1,000 deductible. So you pay the first $1,000 of the bills, and then the services would be covered at 60% thereafter, leaving the student with a 40% coinsurance. So you get to make the decision. We certainly advise that you go to UC because that's going to save you some money, and we do have world-renowned providers and state-of-the-art hospitals that are there to help you. And we are the curative center of San Diego. So a lot of other providers out in the community do send their patients to UC San Diego. One thing that I'd like you to really keep in mind, I'm not sure what country you're coming from or how your health system works, but in the United States, we have primary care physicians, we have urgent care facilities, and we have emergency rooms. And if you are ever in the situation where you've had a sudden or urgent situation where you've been hurt, you are bleeding, you are having a situation where you're unconscious, those are emergencies or urgent situations where you want to access care immediately. So I'm providing you with a picture of our urgent care, which is right down the street from our campus. You hopefully you don't have to walk there, but there are shuttle rides that will take you to this urgent care as well as the hospitals that I've provided. The emergency room is across the freeway that we have here in San Diego, very close to us. And again, a shuttle ride away, or you could walk to the emergency room. Hopefully you don't have to do that. But if you are covered by the student health insurance plan, it's a $150 copay to go see a provider at the emergency room. If you go to an urgent care facility, it's a $25 copay if they're UC. If they're not, it's a $50 copay. So this is a picture of these facilities, and when you are here in San Diego, you will see them. As part of this insurance plan, you do get the medical coverage, the mental health and behavioral health coverage, and we do provide a limited supplemental plan for dental and vision. So there isn't a referral that's required for dental care. You can go directly. We don't have dentists on campus. They are out in the community, but there are some within walking distance. The insurance plan will provide you with $1,000 worth of curative services, meaning if you have a cavity or you need a tooth extracted or a root canal, those services are covered up to $1,000 US dollars. Anything above that, you would be paying out of pocket. To find dentists, there is an 800 toll-free number, and then you can also visit their website. And again, a referral is not necessary to access dental care, and this $1,000 refreshes every school year in the fall. The other plan that is limited and supplemental that we do add is vision care. And we have an optometry unit right here in our student health clinic where we have 3 optometrists that can help you with an eye exam or securing some contact lenses or frames and lenses for glasses. The insurance will cover 1 routine eye exam per school year. And they will also provide you with $120 US dollars to offset the cost of contact lenses or glasses. You can schedule an appointment through my student chart, or you can contact the phone numbers that I've provided for you. I also am providing the Anthem iMed insurance number, so if you want to call them and see what's covered based on your medical needs, please do that. And again, no referral is required for this service. So I've told you all about the student health insurance plan, and now I want to tell you about how to waive that or how to avoid paying that automatic fee that's on your registration. So if you don't act, you will be automatically enrolled in the student health insurance plan offered by the school. If you don't want it and you have another insurance that meets our UC Office of the President criteria, you can waive the insurance. And again, the QR code is provided so you can find out a little bit more about that. That QR code will also take you to the criteria that is set for insurances that need to meet our insurance requirement. The health fee waiver is open all summer. We will open it on May 12th. It's on your Triton link. It's under financial tools, and there's a hyperlink that says health fee waiver. You click on that, it will take you to your single sign-on. Once you sign on, it'll take you to a portal to our waiver application that is run through a company called Academic Health Plans. It's about 5 minutes to fill out that form. You provide your name, your information as a student, and what kind of insurance you have. We will need a copy of the front and back of your insurance card and a short summary of benefits so that we can verify that you have active coverage and that your insurance meets the requirements set forth by the Office of the President. Once you do this prior to the fall, you are waived for the fall, winter, and spring. And then we ask that you submit a new waiver every school year because we have 46,000 students that we're trying to take care of, and we don't know what life events happen for you or if someone has lost their job or insurance or changed their insurance. So we do ask that you do provide a waiver every school year prior to fall. So you have just about 4 months to fill out that waiver, submit it, and get your approval. If you are denied, they will provide you with a reason for that. It's super important that you pay attention to your UCSD email because that is our #1 means of correspondence on this campus. And if we are asking you for more information or you are denied, an email will go to your UCSD email address. And just again, please fill out the waiver every school year. This is a picture of the Triton Link webpage. You'll see under Financial Tools, Health Fee Waiver and Raft. You can click on that and find out more information, or it'll take you right to the application for the waiver process. On the right-hand side or left-hand side, depending on how you're looking at this screen, there is just a snapshot of what is required, your insurance card front and back, and then again, a copy of a summary of benefits that's provided either online or through your insurance plan. The website URL is provided there so you can find out more about how that health fee waiver process works and what's required. Once you fill out that health fee waiver, again, the last question on that waiver application is, would you like to pick up a raft? And the raft, again, is an offering for those students that plan to waive the school insurance. You can pick up a raft, pay a $70 fee per quarter, and you can have unlimited scheduled appointments, lab services, and x-rays here at our student health clinic. So again, keep in mind that the office visit is going to range between $44 to $159. Lab services are probably about an additional $15 per test. Skeletal x-rays are $50 each. So that adds up really quickly. And if you pay $70, that'll pay for itself in one visit. But you can have as many visits as you want. It is not an insurance, so it does not work outside of the student health clinic, but it does provide some peace of mind for students or parents or guardians that are sending their students far away from your geographical area where you really don't know how to navigate the community. So do keep this in mind. Take a look at this. The RAF doesn't pay for vaccines. If you are on the student health insurance plan, as Annie indicated, if you do need a vaccine, if you're covered by this SHIP, it's covered in full. If you're under RAF, you will have to pay for that and then seek reimbursement from your insurance company. We know that the plan is expensive, so we just want to help you with that. If you do want to waive the insurance and you don't have a lot of clinical needs, it's probably a good idea that you take a look at some of the online insurance companies that are offered to international students. 3 of the plans that we will approve on the waiver are ISO Care Plan, PSI Platinum Plan, and you're going to hear from Bella today, who is from the Student Medicover Plan. So you could buy this insurance as long as you're doing it on an annualized basis. Then we will approve your waiver and you don't have to pay for the SHIP insurance, but you will have to follow the rules of her health insurance, and they will give you more information about that after I'm done. Some important dates that I'd like you to keep in mind. Now is the time to start figuring out if your health insurance is going to meet our requirements, or if you are going to stick with the student health insurance plan offered by the school, or if you're going to buy a plan online or outside of the country. On May 12th, our health fee waiver will open on the Triton link. And if you are registered and enrolled in the school, then you'll be able to access that waiver template where you can fill out the form to avoid paying the SHIP. September 14th is the last day to file that waiver within our routine waiver period. We also give you an extended 5 days to fill that out, but there is a $50 late fee. So the deadline for the waiver is really September 20th. After that, we won't accept any late waivers or retroactive waivers. And then September 22nd is when you come here and the fall quarter officially begins. You may not start classes on that day, but that's when our fall quarter starts. And if you are covered by the student health insurance plan, that would be the first day that you have coverage and insurance will start paying on your behalf. I want to leave you with some resources. We have lots of contacts that you can exercise to find out more about our student health and well-being clinic here on campus. Some phone numbers for you, and you can find out more about CAPS, the insurance plan, Anthem Blue Cross, who supports the insurance, Delta Dental, who provides the dental insurance. OptumRx is your benefit manager for pharmaceuticals or prescriptions. If you have any problems with our UCSD health side, there's some billing contact information for you. Our academic health plans is who provides the waiver. You can contact them. Our financial clearance department at our hospital will provide you with estimated costs of services if you do have any hospital-based services. And then we are on Zoom Monday, Wednesday, and Friday. And this is Pacific Standard Time, 11 a.m. to 12 p.m. If you want to dial in and talk to one of our insurance coordinators face-to-face, please do that, and we'll help you with anything you might need. And I just want to thank you. We are on social media. If you want to access us on Facebook, Instagram, or YouTube, we'll be there for you. And if you want to email us with any questions that you might have, we're at ship3@ucsd.edu. I thank you and I congratulate you for coming to UCSD. And if you do see me around campus, please stop me and say hello.
Hi, thank you, Joel, for sharing those valuable insights about the UCSHIP, and welcome all new Tritons. Again, I will introduce myself a little bit. I'm Bella. I'm a proud UCSD alumni from class 2020. I joined Student Medical Cover in 2020. We have been serving the UCSD community since 2016. Alongside with Joel and her office, we are able to save insurance costs and provide a comprehensive service to UC San Diego students. So I'm excited here to discuss an alternative to UCSHIP, one that saves you money while delivering a comprehensive coverage for international students. Also, as an appreciation for attending this webinar, we are offering a free emergency care kits to every student that attend the meeting today. So just screenshot this page and email us using your UCSD email address, so we can give you a free care pack and mail it to your door at zero cost. So Student Medical Cover partner with United Healthcare Student Resource using Choice Plus PPO network, giving you access to a tier medical care in UCSD area, such as UCSD medical centers. And you can also access to 1.4 million in-network provider within the US. So if you are under 25, our most popular plan costs just about $360 per quarter. And we also has other plan that with zero deductible. We have different insurance plans tailored to your need and saving you money while keeping you protected. We know that navigating the healthcare in a new country can be overwhelming. That's why we offer 24/7 multilingual support and a step-by-step assistance with claim issues, and network provider, and emergency suggestions as well. We also, my team specializes in guiding international students through the waiver process. So we have a step-by-step waiver guide for each international students. Last years, we helped over 900 UCSD students successfully waive the UCSHIP, saving students money about $1,000. And for undergrad, you can also save about $4,000 every year. So today, just don't wait until the last minute, like Joy mentions. Your waiver deadline is September 14th. If you would like to know more about us, there is a QR, our contact information and a QR code that you can scan. And don't remember to screenshot this page so that you can claim your free care pack and email us if you have more questions. Thank you.
Thank you so much, Bella. As was mentioned, healthcare is quite challenging to navigate. And so thank you to our presenters today for sharing the information. We hope that, you can go back to these slides, watch the recording again. Don't hesitate to contact and connect with the offices that any of our presenters are representing. At this time, I also would like to encourage you to start submitting your questions if you haven't done so already, as I quickly go over the last few slides. So a big part of your experience here is getting engaged, right? Classes and navigating all of the, transitions with moving to the new countries can be a lot, can be pretty stressful. And so by providing a comprehensive offering of programs and events, we want to make sure that you're having fun and you have, a great social life here as well while attending UC San Diego. So ISEO offers a variety of core programs. We also refer to those as I programs. And so those range from, one-on-one partnerships for, improving your English conversation to game nights, to advocacy efforts, coffee hours. So if you would like to learn more about our programs, please visit iprograms.ucsd.edu. And then a place that I highly recommend use, bookmark as well, is our iEvents calendar. So whenever our office or our campus partners offer fun events on campus, all of those will be available on our iEvents calendar. So it's a great way to, find your community and attend fun opportunities. We also offer a Global Ambassadors program. This is a peer mentorship program over the summer. So if you would like to connect with a current undergraduate student here at UC San Diego to help you navigate the transition over the summer, I recommend you scan this QR code and fill out the form. It should take you about 10 to 15 minutes. But this is a great opportunity to meet students even before you arrive to campus. The welcome guide will be your go-to for any checklist and important steps to complete as you prepare, start your classes, prepare for arrival, and when you arrive to San Diego. This is located on our guides page, so you'll see the link here on the slide. The other guide that I'd like to say that is pretty popular with our students is our Surf Check Coming to UC San Diego guide. So this was created by students for students, and it covers most important topics that students are interested in when transitioning to college, such as housing, arranging transportation from airport to campus, setting up any of your accounts. So you'll have a lot of different sections there. So we highly recommend that you visit our website to check it out. And then similarly to our partners, we are on social media. So don't hesitate to, follow us on LinkedIn, Facebook, or Instagram. We're also on YouTube, which is where all of our recordings will be posted. Few additional resources. In particular, I would like to draw your attention to deadlines and timelines. So right now is a great time to start requesting your documents. So this will be done through our iServices page. So I apologize, there's a typo on this slide, but the system that we're using for all newly incoming students are iServices.ucsd.edu. You can apply for on-campus housing now. The housing contracts will be due mid-May. And then July, as was mentioned earlier, is when the deadline for health immunization requirements will be. And then in September, this is where you'll be here. You'll pay the tuition fees, and then you'll start the moving process, as well as participating in our new international student orientation. This is a quick rundown of upcoming pre-arrival webinars. So next week we'll cover finances and student accounts. So this is an important tool for how to pay your bills while you're here. If you're currently attending a community college or a high school in the United States and you need to transfer your CVIS record, April 17th is when we'll go over the CVIS transfer process. Getting involved in campus safety will be in late April, and in May, we'll talk about getting set up. Last slide before I open it up to live Q&A is the survey. So we want to make sure that we continue to improve these presentations. So please fill out the survey by scanning the QR code so that we can continue to offer the best, pre-arrival webinar content that we can that support your needs. And then this is just the contact information if you'd like to get in touch with us. I know there were a few Q&A questions that we've answered already by typing. So if you've submitted one of those, please go ahead and reference those in the Q&A feature. Thank you, Annie, so much for addressing those. And yeah, I'll give folks a moment to just submit those questions so that we can cover anything else that you would like to learn about. So that can be done through the Q&A feature on your panel. And then as well, while you do that, just want to draw attention to the chat. There was a lot of great content shared there in terms of contact information and websites. So please feel free to save those as well so you can navigate the processes after the webinar. Okay, looks like there are no questions in the Q&A feature. If something comes up after the webinar, please don't hesitate to contact any of us so we can further support your transition to UC San Diego and making sure that you're meeting all of the requirements to successfully start your program here. Once again, congratulations on your acceptance. We're really excited to meet you all when you're here in the fall. And that is all for our student health requirements webinar. Thank you so much for joining. I hope you have a great rest of your day.